Forensic Medicine and Political Accountability, Science, Symptoms, and State Power. A hybrid, academic-applied fictional narrative. Introduction in political crises, accusations of incapacity, hidden illness, or psychological instability often become part of public debate. But how does forensic medicine, an evidence-based discipline, actually evaluate such claims? This video explores how forensic science supports or disputes allegations involving mental health, memory lapses, insomnia, drug side effects, stress disorders, or even feigned symptoms. We will examine 3 layers. 1. A. Academic framework. How forensic medicine is used in impeachment or high-level investigations. 2. B. Applied analysis. How medical evidence is evaluated without taking political sides. 3. C. Fictional scenario. A dramatized case in a fictional country to illustrate how science works without referencing real political figures. Sa mga panahon ng pampulitikang krisis, madalas nagiging bahagi ng usapan ang mga paratang tungkol sa kakayahan, nakatagong karamdaman o umano'y problema sa pag-iisip. Pero paano ba sinusuri ng forensic medicine ang ganitong mga aligasyon? Sa video na ito, tatalakayin natin kung paano ginagamit ang siyensya upang suportahan o pabulaanan ang mga paratang tungkol sa mental health, memory lapses, insomnia, epekto ng gamot, stress disorders, away-away ng familia o peking sintomas. Part A. Academic Framework isa. What forensic medicine actually does English. Forensic medicine provides objective, scientifically grounded evaluations. It does not determine guilt or innocence. It determines facts about the body, brain, and behavior. Key domains include forensic psychiatry, forensic pathology, toxicology, neuropsychological testing, sleep and stress assessment, malingering detection. Tagalog, ang forensic medicine ay nagbibigay ng objetibong pagsusuri batay sa siyensya. Hindi nito hinuhusgahan kung sino ang tama o mali. Sinusuri nito ang katotohanan tungkol sa katawan, utak at pag-uugali. 2. Forensic medicine in impeachment or high-level investigations. In many countries, impeachment inquiries may involve medical records review, independent psychiatric evaluation, toxicology screening, cognitive testing, assessment of decision-making capacity, evaluation of alleged memory lapses or psychological instability. Courts and legislative bodies rely on expert opinion, but the admissibility of such evidence is governed by strict rules. Research shows that courts often struggle with evaluating expert medical testimony, sometimes admitting weak or speculative evidence if standards are unclear. Sa ilang bansa, ang impeachment o mataas na investigasyon ay maaaring mangailangan ng pagsusuri ng medical records, independent psychiatric evaluation, toxicology screening, cognitive testing, pagtatasa ng decision-making capacity, pagsusuri sa sinasabing memory lapses, or psychological instability 3. Reliability and admissibility of medical evidence. Scholars warn that courts sometimes admit unreliable or weak forensic evidence, especially when judges lack scientific training. This has contributed to wrongful convictions in several countries, negatively being swayed by corruption. Experts argue that reliability, not just credentials, should determine whether medical testimony is allowed. May mga babala mula sa mga eksperto na minsan ay tinatanggap ng korte ang mahina o hindi maaasahang forensic evidence, lalo na kung kulang sa scientific training ang mga hukom. Kaya mahalaga ang reliability ng ebidensya, hindi lang ang titulo ng eksperto. Part B. Issue-focused, non-accusatory analysis isa. Evaluating claims of hidden medical conditions. A. Memory lapses. True memory impairment can arise from neurological disease, trauma, sleep deprivation, medication effects, stress disorders. But forensic psychiatry uses structured tests to distinguish real impairment from malingering, feigned symptoms. Ang totoong memory impairment ay maaaring dulot ng sakit sa utak, trauma, kulang sa tulog, epekto ng gamot o matinding stress. Pero may mga structured tests ang forensic psychiatry para malaman kung totoo o peke ang sintomas. B. Insomnia and stress disorders. Chronic insomnia affects concentration, judgment, and emotional regulation. Stress disorders, especially in high-pressure political roles, can mimic or exacerbate cognitive symptoms. Ang matagal na insomnia ay nakakaapekto sa konsentrasyon at pagdedesisyon. Ang stress disorders ay maaaring magmukhang cognitive impairment. Kahit hindi naman ito neurological disease, Tagalog, ang matagal na insomnia ay nakakaapekto sa konsentrasyon at pagdedesisyon. Ang stress disorders ay maaaring magmukhang cognitive impairment kahit hindi naman ito neurological disease. Parang lasing kapag lagi kulang sa tulog. C. Drug-related side effects. Some medications cause sedation, impaired judgment, slowed reaction time, anxiety or paranoia. Toxicology can determine whether levels are therapeutic, excessive or inconsistent with prescribed use. May mga gamot na nagdudulot ng pagkaantok gaya ng higher medications for moderate pain from previous muscle bone injury, especially sa gulugod o spine, mabagal na pag-iisip o minsan ay paranoia. Sa clinical forensic toxicology nalalaman kung normal, sobra o kakaiba ang level ng gamot na kailangan ng one whole blood plasma sample for examination sa isang clinical pathology laboratory. D. Psychological or psychiatric conditions. Forensic psychiatry evaluates mood disorders, anxiety disorders, psychotic symptoms, personality disorders, stress-induced cognitive changes, but it must avoid political bias. Evaluations are standardized and evidence-based. Sinusuri ng forensic psychiatry ang mood disorders, anxiety, psychosis, personality disorders, at stress-related changes pero dapat walang bahid ng politika ang pagsusuri. Part C. Fictionalized Scenario The Republic of Lumerialalana, a Case Study. To illustrate how forensic medicine works without referencing real political figures, imagine a fictional country, Lumerialalana. Its Vice President, Aurelio Vos, faces impeachment after allegations of erratic behavior, memory lapses, and questionable decision-making. A congressional panel orders a forensic medical inquiry. 1. The allegations. Vos allegedly forgot key security briefings. He appeared disoriented during public events. Rumors spread about insomnia and medication misuse for a previous spinal injury sustained in a traffic accident. Some claim he is feigning symptoms to avoid accountability. Sa bansang ito, ang vice-presidente na si Aurelio Vos ay inakusahan ng pagiging magulo, makakalimutin at hindi stable. Nagpasya ang Kongreso na magsagawa ng forensic medical inquiry. 2. The forensic evaluation experts conduct neurocognitive testing sleep study, toxicology, screening psychiatric interview, collateral interviews with staff, review of medical records. Findings show severe chronic insomnia, medication interactions causing cognitive fog, stress-induced anxiety. No evidence of malingering, no signs of psychosis or dementia. Lumabas sa pagsusuri na may matinding insomnia si Vos, may side effects ang kombinasyon ng gamot at mataas ang stress level niya, pero walang ebidensya ng pagpapanggap o malalang sakit sa pag-iisip. 3. The political interpretation science provides facts, but politics interprets them. Some lawmakers argue Vos is unfit. Others say he is simply overworked. Forensic medicine does not decide impeachment. It only clarifies the medical truth. Ang siyensya ay nagbibigay ng katotohanan, pero ang politika ang nag-i-interpret. Hindi trabaho ng forensic medicine ang magdesisyon sa impeachment. Trabaho nito ang magbigay linaw sa medical na katotohanan. Conclusion. Forensic medicine is a powerful tool for truth-seeking, but it must be used responsibly. Whether in real nations or fictional ones, medical evidence should never be weaponized. It should clarify, not distort, the truth. Makapangyarihan ang forensic medicine medicine pero dapat itong gamitin ng may pananagutan. Sa totoong bansa man o sa katang-isip, hindi dapat gawing sandata ang medikal na ebidensya. Dapat itong magbigay linaw, hindi magpalabo. Sa mga Filipino citizens, dapat nating pray na yung mga high officials ay laging magkaroon ng divine presence Shekinah and gabayan ang ating bansa patungo sa peace, order, and stability and reflect the glory of the Lord, Yeshua, Messiah. Sa mga Filipino citizens, dapat nating pray na yung mga high officials ay laging magkaroon ng divine presence Shekinah and gabayan ang ating bansa patungo sa peace, order, and stability and reflect the glory of the Lord, Yeshua, Messiah. Sa mga Filipino citizens, dapat nating pray na yung mga high officials ay laging magkaroon ng divine presence Shekinah and gabayan ang ating bansa patungo sa peace, order, and stability and reflect the glory of the Lord Yeshua, Messiah. Mabuhay ang mga Pilipino! Mabuhay ang mga Pilipino! Mabuhay ang mga Pilipino! Mabuhay ang mga Pilipino! Mabuhay ang mga Pilipino!